Today, we're re-diving into a topic that has been making waves in the medical and scientific communities: the potential link between taurine, a common ingredient in energy drinks, and the development of blood cancer, particularly leukemia. If you regularly consume energy drinks like Red Bull, Monster, or take supplements that contain taurine, I highly recommend you watch this video until the end. What I'm about to share comes from a recent peer-reviewed study published in the journal Nature, and it could significantly change the way we think about this widely used substance. So, what is taurine? Taurine is an amino acid that our bodies produce naturally in small amounts. It's also found in foods like meat and fish, and it plays several important roles, supporting heart function, electrolyte balance, and the nervous system. For years, taurine has been considered safe and even beneficial. In fact, some studies suggested it had antioxidant and anti-inflammatory properties, and it's even been used to reduce the side effects of chemotherapy in cancer patients. But here's the twist. A new study out of the University of Rochester has revealed a potential dark side to taurine, especially when it comes to myeloid cancers, which includes some forms of leukemia. What did the study find? Researchers discovered that leukemia cells, specifically those in acute myeloid leukemia, don't produce taurine themselves. Instead, they rely on a specific transporter called SLC6A62 absorb taurine from their environment, mainly from the bone marrow. Once inside the cancer cells, taurine boosts a process called glycolysis, which is how cells break down glucose to produce energy. In cancer cells, more energy often means faster growth and more aggressive disease. In experiments with mice, those given taurine had a dramatically faster progression of leukemia. Even more alarming, they had a threefold increase in mortality compared to those not given taurine. This isn't just a small effect. It's a powerful insight into how something widely considered harmless, or even healthy, could potentially fuel cancer growth under certain conditions. What does this mean for humans? Let me be very clear. This study was conducted in animals. It's still too early to say definitively how taurine behaves in humans with leukemia, but the findings are significant enough to warrant serious caution. If you're a healthy individual, moderate amounts of taurine, especially from natural food sources, are unlikely to pose a threat. However, energy drinks and taurine supplements can contain doses far beyond what you'd normally consume in a typical diet. And here's the concern. If someone already has undiagnosed blood cancer or is in a high-risk group, high taurine intake could potentially accelerate the disease without them even knowing it. Should you stop drinking energy drinks? That depends. If you're consuming them occasionally and don't have any known blood disorders, you're probably not in immediate danger. But if you someone who drinks them daily, or if you undergoing cancer treatment, or have a family history of leukemia, you should seriously consider cutting back. And remember, energy drinks often come with a cocktail of other problematic ingredients, like high levels of caffeine, sugar, and artificial stimulants, that put additional stress on your body. A word about supplements. Another place where taurine hides is in pre-workout formulas and sleep aids, marketed for everything from muscle recovery to improved focus, and many of these products contain taurine in concentrated doses. Right now, there are no official guidelines warning cancer patients or survivors to avoid taurine, but based on this new evidence, I would advise caution, especially if you're in active treatment for any type of leukemia or myeloid cancer. Talk to your oncologist. Let them know if you're using energy drinks or taurine-containing supplements. It might make more of a difference than you think. Final thoughts. Science is always evolving. What we thought was safe yesterday may not be safe tomorrow, and that's the beauty of research. It challenges assumptions and helps us make better decisions for our health. This new study doesn't mean taurine is universally harmful, but it does mean we need to be mindful of how much we're consuming and who is consuming it. If you found this information helpful, please leave a like and share it with someone who might need to hear it, especially those who rely heavily on energy drinks or are going through cancer treatment. And if you have questions, drop them in the comments. I'm always here to help you navigate health topics with clarity and evidence-based insights. Thanks for watching, and take care of your health. It's the most valuable thing you have.